Okay, now we're off and running. Back to sharing my screen. Okay, back to the presentation. Okay, so injury prevention for everyone, which is so important. We don't want you all to get bogged down with injuries. And so we are here to help you stay strong and pain-free during your 8-week program. As you all know, physical therapy is just one part of the four-pronged approach to ARC, and that's the running coaching, the mindfulness, the mentorship, and the physical therapy. And we do have a nutritionist as well giving tips. But the coaches also provide a lot of feedback with that as well in terms of the best things to do before you run and during your run and after your run. So we're going to work together tonight to provide this information to you all. So first off, today we're going to cover some of the more common injuries of the low back and hip, the knee, and the foot. And we're going to try to focus on what I know is going on with you all because, I did your intakes, a lot of you, and we kind of know the problems that you're facing. But I want you to feel free to please unmute yourself and ask a question at any time. I'm not offended, and that is the best way for me to see that you have a question. So let's dive right in. So the first thing I want to talk about, because it can be really, really confusing, and many of you in this cohort are experiencing this, and that is irritation to the nerves in your back. So you hear people say like, oh, I slipped a disc, or I have sciatica. That all refers to irritation that causes pressure on the nerve in your back, which is pictured here. And as you can see in the picture with the leg here, the nerves run all the way down to your foot. So if you have an issue in your low back, it can cause referred pain to your bottom and all the way down your leg. So this is really important to be aware of, because sometimes you feel pain in your hip, pain in your leg, pain in your calf, pain in your foot, and it's actually coming from your low back. So here we have the intervertebral discs, and it shows how the discs are between the vertebrae and the spine. And when the disc gets irritated, it can cause pressure on that nerve, which causes that referred pain. One thing that I really want to share with you all are some of the positions that really load our lumbar disc. So if you have pain in your bottom or your back, or numbness or tingling or anything that goes down your leg, or a history of those things, I want you to really be listening right now. So this is a chart of the different positions in our day-to-day activity that causes increased loading to our discs in our low back. So you'll note that as we go up, and the pressure increases, you can see people are sitting in poor posture, or they're bending forward. Bending forward with a load like groceries or picking something up off the ground is one of the most compressive ways to load that disc, and really a no-no. So if you're having low back pain, I would suggest that you be really, really careful about bending forward, also about twisting, because this is going to help prevent irritation of the disc in your low back. So this means if you're a yogi, the downward dog, because of the bending that happens, really kind of consider some of those positions before you do them, because I don't want you to hurt yourselves. A lot of people, their disc is right on the edge because it's a repetitive trauma over time. And then you'll hear someone say something like, all I did was put my shoe on or tie my shoe, and then my back went out. That's because it's that repetitive trauma of bending over time, and eventually the disc just gives way. This picture I included too, because I wanted you all to see that little yellow thing in the picture is the nerve. So I wanted you all to see how the nerve goes down the leg, and that sometimes if we do a hamstring stretch when we have low back pain, it pulls that nerve all the way up at our spinal cord. And this means that you can actually irritate your low back by doing hamstring stretching. So it's always a balance, right? If you've had a hard run and you have pain in your hamstring, you may need to do a little stretching. There might be alternatives like foam rolling or some other things that you can do, but always knowing and being aware that those things can potentially increase your pain. It's one of the biggest misconceptions. A lot of people think I have back pain, I should stretch my hamstrings, but a lot of times that's actually not the case. Please unmute yourself and ask questions at any time, you guys, if you have questions. So this next picture here, the picture on the top is showing referral patterns that come from the low back. So, right, it's so tricky. So you see how in these pictures, people are having pain in their bottom and down their leg. And it seems like, oh, I must have pulled my hamstring. Like, look at the distribution. It's right where the hamstring is in some of these cases. But many times it can come from the low back. So if you're confused on whether you have a low back issue, please reach out to me. With a lot of you, we've gone through and kind of determined what could be going on, and if you do in fact potentially have an issue. On the bottom here is an exercise that's really good for low back pain. If you find that you ache across your low back at the end of your workday, or at the end of sitting, or after you're sitting on the couch for a while, this is a great one to try. It's called McKenzie Extension. McKenzie is a guru who has done a lot of work with low back pain. But it's basically you brace yourself with your hands on your hips, and you're bending backwards and holding that stretch for 10 seconds. And if you're really hurting, you can try it multiple times per hour. But of course, if you're really hurting, I want to hear from you too, so I can help you navigate through those symptoms. Something important to understand is if you're having back pain, training your abdominal muscles can be essential. Now, even if you're not having low back pain, your core is so important for stabilizing your whole body. So this picture here kind of shows like when they used to wear corsets back in the day, that our transverse abdominals, so the ones that wrap around our body, can actually act like a corset and help stabilize our body. So some of the exercises that I like to give as a physical therapist help to train those muscles, the transverse that wrap around, not the rectus that wrap in front, but the transverse abdominals that wrap around. And then I wanted to throw in a slide about the hip, because a lot of people, it's a very common for runners to get an IT band irritation. You can have pain that's right on the outside of your hip. Usually if it's in your bottom, it's not coming from the IT band, and it's not coming, a lot of times it's not coming from the hip itself. Every now and again, people can get an injury of their hamstring at the insertion, but this is the IT band. You can also have knee pain on the outside with IT band syndrome. But many times it's a little bit misdiagnosed, and you can flare up your back or other things if it's not diagnosed appropriately. But that's a picture of what it is. And then here is the anatomy of your knee. So many of you in this cohort have had some kind of knee pain. And so I wanted to include this slide to kind of show you what's going on inside the knee, so that you can think about, why you have pain with certain, workouts, and how to best prevent that pain. So on the normal knee side, you see what the cartilage looks like and what the knee looks like, when we're in our young years, maybe our late teens or early 20s, if we haven't done a lot of really high impact exercise, and we haven't injured ourselves. As we age, the natural process of aging, just your joints start to show a little wear and tear. If you've been really active, sometimes there's more wear and tear. If you've had an injury, there could be even more wear and tear. And so you see how the cartilage and the joint itself can kind of degenerate and have such a different surface than a normal knee. And this is why we have pain sometimes when we're running, because those articular surfaces are coming together there, and it can cause pain. So what do we do about that? We're going to talk about it a little bit more, but strengthening your hamstring is a really nice solution. Unweighting your knee, walking in a pool. There are a lot of things we can try, and then stabilizing our body, starting at the foot up. So our nice good shoes that I know everyone is receiving from BGR and Brooks, and making sure that you're stabilizing your foot even when you're at home. And speaking of the foot, talking a little bit about the foot, I know to my cohort, to the part of the cohort that has me as their physical therapist, my tip last week was on the foot. And that's thinking about what your foot looks like, not just when you're standing still, but kind of watching it as you're walking as well. And we're looking here to see if the foot has a normal arch, which is what you see on the left here, or if you see your arch completely drop down and that your foot is basically flat with the ground. So if you have a flat foot, you're going to be predisposed not only to foot pain, but also to pain that translates up and can cause knee pain or back pain. And so you really want to get a shoe underneath that foot that helps support the arch, so that you don't have pain with running. And the other piece of that is when you're around your house, wearing a slipper or a flip-flop does not offer good support for that foot. So to really help prevent irritation and pain, I always suggest to maybe have a pair of sneakers that you just wear in your house if you want to have something that you don't wear outside to prevent germs and whatever. And also, if you're going to work, to really, I know we all love our cute shoes, but try to keep the time that we spend in our cute shoes at a minimum, because that really can increase irritation too. And just to show you how that happens, this picture here shows what happens when your foot is flat. So you see the arrow on the bottom here. The foot is flat and it's starting to collapse down to the floor. And then you see how the knee then collapses in too. So we can get irritation in the medial compartment of the knee. And then that can also translate it and even affect our back. So we call that the kinetic chain. And it really is true that if we start from the foot up with stabilization, we can help prevent pain throughout the body. Any questions so far? Feel free to jump in. This is another picture of the kinetic chain and how shoes without support can poorly affect our body. This also goes for walking barefoot. So if the foot is flat, and that's what we call overpronation, we get that twisting in, then the leg can twist in, the knee moves inward, the hip rotates inward, the leg rotates inward, the pelvis. And so you see all the different things that happen. We call that mechanical dysfunction that can happen throughout your body if you don't have good shoes. So a few exercises from a physical therapy perspective to work on some of these things that I just talked about. This exercise here shows a transverse abdominal contraction. Many of you may have received this exercise in your packet, and it does now have, I didn't include it for the slides because it's too small to read, but it does have a description of what to do. But basically in this exercise, you're drawing your stomach in and up, almost like you're elongating your body as you pull in your transverse abdominals. If you kind of touch your stomach just above your pelvis, you can feel those muscles turning on. And you want to practice this exercise, not just laying down like I'm showing you here, but sitting up, walking, in the grocery store, wherever you are, and then eventually translating it to activating those abdominal muscles while you're running. This next exercise, many of you are probably familiar with. Again, it's just a progression of training those transverse abdominals. And we're alternating we're meeting our right knee with our left hand and our left hand with our right knee. And our right hand with our left knee. So alternating is what's happening here. And all the time activating the low back. And you all, whenever you do any of these exercises, no pain. You should have no pain in your low back. If you are, then you need to back up and do an easier version of the exercise. Questions? Okay, next one is the plank. And so I think most of us are familiar with the plank. If you have pain in your elbow or your wrists when you do this one, do not do it. And really holding a plank for only 10, 15 seconds is a great place to start. So your abdominal muscles should be contracted, and then you're holding yourself in the plank. Remember, I talked about hamstring strengthening to help stabilize your knee. This is a picture that shows a hamstring curl with a therapy ball. So in the first picture, my feet are resting on the ball. In the second picture, I've pulled my tummy tight and my bottom tight, and I'm bending my knees and curling that ball towards my bottom. And that's activating the hamstring muscles on the back of my thigh there. This is an awesome, awesome, awesome exercise. I can't emphasize enough how important the hamstring muscle group is to prevent knee injury. It helps hold the bottom, the tibia, the bottom bone in your leg back, and really can prevent irritation. Okay, now we're on to a few more exercises. I'm going to have India. India, do you want to jump in here, or do you want me to complete out the exercises, and we'll have you jump in the pre-run warm-up?
You can go ahead if you want to, whichever one. I'm ready.
Yeah, you can jump in. Go for it.
All right, so this here is for hip and glute strengthening. So this is the fire hydrant. Now, what's important with this exercise, you are going to be on all fours and you take one leg out to the side. The biggest thing with this, so that you don't have or don't cause any extra injuring, is so that you don't move your hips over to the left or the right. So you want to ensure that you're not swaying to the left or the right. You want to stay stable in the center, and you want to bring your leg up to the side as far as you can. Now, the other thing you want to make sure that you're not doing on this exercise is dipping your stomach down in the bottom or bending your back. So you want to keep your back as flat as possible. This here is going to help to strengthen your hips as well as your bottom or your glutes right on the sides. That will definitely help to strengthen that. And of course, like Gina has mentioned, a lot of times when it comes to some injuries such as knees, a majority of the time, if you strengthen your glute and your hamstrings, that will help to minimize the pain in those areas.
Exactly. So there's tons of research out there that supports the hip and the glute strengthening to support your knee and prevent injury. One other thing I want to touch on with this one too, if you do have knee pain and kneeling, even on a mat, bothers you, there are alternatives too that we can do where you don't have to kneel if that does bother you. And here it is. So the alternative is laying on your side, and you're going to lift up and back, and that way you don't have to put pressure through your knee. So that these are two options to try, both with the same goal. And it's important to note with this one, I'm not just lifting up, I'm lifting up and back, just sort of like India was showing in the other exercise with the fire hydrant.
Now, this is another exercise that you can do, which is the donkey kick. So you are in the same position as the fire hydrant, and you're on all fours, and you are taking your leg to the back. Now, you want to ensure that you keep your foot as flat as possible, and you, again, do not dip your stomach down or bend your back. You want to try to keep your back as straight as possible. And this as well is going to help with your hips and your glutes. Now, with these exercises, a good rule of thumb or just a good roundabout time frame that you can do this is add these into your strength training days, and you can do 8 to 10 reps about 3 or 4 times, and that will give you a good amount of exercise to kind of add to the days that you are doing something other than running. Or if you are running and do a hard day, you can add these onto the end of your workout.
Excellent. And if you're taking notes too, a way to make this harder is to hold for longer. So you could start with just a pause, like a beat when you get your leg up there. And then you could extend your holds. You know, you can hold for 3 seconds or 5 seconds or 10 seconds. Another thing to add if you are taking notes is if you do have back pain, this is actually a really good one because you're getting a little extension through the lumbar spine when you do this. You're not supposed to be bending your back at all, but you're just getting natural extensions from the glutes. So this is a good one if you do have back pain.
All right, and this is another one. So this is one that will also help to strengthen your hips and your glutes. And this, you're going to lay flat on your back. And on this one, you're going to make sure that your back is laid completely flat on your back. And then you're going to lift your hips to the ceiling. You want to do your best to keep your back and your shoulders on the ground, and you're going to lift your hips to the ceiling. Now, like Gina just mentioned in regards to holding it, that is something that's really good with this exercise is once you get to the top, you can squeeze your glutes and actually hold it and then go down, and you can do that in repetition. And that will help to strengthen your glutes as well.
Excellent. And this is one too where we can add a band around our thighs. That's another progression of this one if you have a therapy band at home, where you're putting a little resistance and training your hips as you bridge up as well. So that's a progression for this one. Okay, next up, eccentric calf strengthening. Eccentric means that we're working the muscle when we're going the opposite direction that it contracts. So in other words, we are going up, which is the contraction of our calf muscle, and then we're working it as we're lowering ourselves down. This is an excellent exercise to stabilize your foot, but also if you have Achilles pain in the back of your heel there, or calf pain. So you're going to go up on a 1 count, and then you're going to go down nice and slow. So up on your toes on a 1 count and down 1, 2, 3 to the ground. Some people like to do this on a step, and that can be effective as well. And here's some stretching for your calves. The top picture shows the back leg all the way straight. For the more superficial muscle, it's the gastroc. And the bottom picture shows it bent a little bit. Again, this is one that almost all of you have received in your physical therapy handouts, and it specifies there holding for 30 seconds twice on each side. And making sure, sometimes it's hard to remind ourselves to hold that stretch. I like to use a phone or a timer because otherwise we tend to fly through it and the muscles don't have time to really respond. Here's an IT band stretch. So I'm stretching the right IT band in this picture. I have my right foot behind my left, and I'm hiking my hip out towards the wall. Notice I'm not bending a whole lot in my trunk. I'm bending a little, and that's to protect my back. If you have back pain when you try this stretch, again, just being really careful. And anyone who needed the IT band stretch, I didn't have a ton of people in my group this time, but if you did get it, it comes with the two sets of 30 seconds. Okay, now we'll get into some recommendations for pre-run. I'll let India take it away again.
Yes, for sure. So when it comes to pre-run, we want to ensure that we are doing dynamic stretches. Dynamic stretches usually are drills to help with the range of motion. So those are not usually stretches that you're going to hold in place, but they're actually movements that help you to loosen up the body so that, and it's usually the same type of motions that you would use when you're actually running. In this picture here, you will see leg swings. So I start with, and I'm actually holding on to the wall to the side, but the top picture, I have my leg going to the back and then swinging up to the front of me. Now, again, like Gina has explained, you want to be careful with some of these dynamic stretches, that if you have any back pain or lower back pain, you don't want to aggravate it. You don't want to aggravate it a lot. And then also when you're doing these leg swings, your full body should not be moving. It should be the leg only. So you don't want to be twisting and turning the top part of your body. You don't want to be bending over with it. You want to keep the motion in the leg. Another exercise to the left is the knee grab. So you will keep the leg that's planted on the ground straight, and then you will pull the actual, the opposite leg up to your chest. Now you want to do this you want to go from one leg to the other. A lot of times people like to walk in place while doing it. So they'll pull the right leg, put it down, pull the left leg, put it down, and you can actually walk forward while doing it. And it helps so that you can actually loosen up some of the areas in the lower back, as well as the glute and the hamstrings with this one. You want to ensure that you want to warm up as much as you can before going out for a run. It's almost like your muscles are like putty. If you go out for a run and you just go step right outside your door and go for a run, you don't want anything to what we consider like pop. You don't want anything to go into a bad place. And so if you warm up your muscles, it will help for you to be able to lift your knees, pull them together, and just ensure that your run is a little bit more fluid, which is really, really important. Now,
go ahead.
Go ahead, Gina.
I was going to say, yeah, and also the hamstring swing here in particular. Remember I mentioned the tear of the hamstring up in the bottom. No one wants to have that because it's really, really tough to come back from. And this helps us dynamically warm up that muscle so that it's not so tight when we're getting out to run and pushing our mileage and pushing our pace a little, and we end up injuring. The likelihood of that is low with because our coaches are so excellent with our progression. But this is a good way to prevent that.
Definitely. Now, as Gina just mentioned progression, there's a couple things that I want to add. Gina did talk about shoes and how you pronate when you actually strike the ground and when you hit the ground when you're running. So I know some of you may be saying, well, how do I know what my foot looks like when I'm running, and what does that actually look like? So you want to ensure that you can find out if you need a neutral or stability shoe. That is the way that you can do that is you can actually go to a running shoe store somewhere like Fleet Feet, Road Runners. Those are some of the universal shoe stores, and they can do a running or gait analysis for the foot and just help to see kind of what that looks like. And a lot of times they put you on a treadmill and they can actually take video of what it looks like for you to actually run. Now, of course, with the stability shoe, that is going to be a shoe that is going to help to keep your foot together. If you do pronate a little bit, it helps to stabilize. So if your ankle or your arch drops, it can help to stabilize that in one place. And something else that you would like to do when it comes to shoes is rotating out different shoes. So a good thing to do is to have at least 2 pairs of shoes that you can wear at different times. This helps to limit the amount of pressure that you may be, or work that you're putting on one muscle in the shoe if you have different types of shoes. It also helps to keep a good cushion on the bottom of a shoe. Of course, we know that if you're running miles every week, you're putting more mileage on those shoes. And of course, they start to wear down and you start to work different muscles in the body. So a good rule of thumb is to use each shoe 300 to 500 miles. So if you actually have, some people have tracking apps. I know the Nike Run app can help you to track your mileage if you don't have mileage on shoes, if you don't have like a Garmin or things of that nature. But I know that the Nike app, and I believe Runkeeper does as well, you can actually track the amount of miles that you have on each shoe. Now, another thing that you can do in regards to shoes is that you want to ensure that you have a thumb width of space in the front of your shoe. And that gives you enough space to, if your feet swell or if they slide while you run, that you don't continue to have your toe to hit up against the front of the shoe. That is a good enough space, because you don't want your feet to be balled up. You want to ensure that they are flattened out. This is another stretch that is just like the for hamstring. This is a hamstring swing. You will put your foot out in front of you and you will actually scoop the air up. So you will have your arms from the back of your calf area and scoop it up towards the ceiling. This will help to stretch out the back of for your hamstrings. Again, this is another one you want to be cautious on if you have any back injuries, lower back pain, anything of that nature. You want to be cautious on doing the front bend over, but it is really good to stretch out the back of your hamstring.
All right, awesome. I think we're going to shift now during the run. I think Dana's going to take over for a minute and talk a little bit about form during the run, and then we'll go into some of the recommendations after your run. So Dana, I'll let you share with us some recommendations on form.
Great, so many good tips. I love it. So form is something that we all naturally have. We all head out the door, we all kind of fall into our rhythm, but there's a couple cues and tips that can help prevent injury. It can help you to run more efficiently with less energy, which is nice, right? So we want to think about head to heel, just a few tips. So starting with our head, a lot of times we either, lean our head forward, lean our head back, but I want you to think about putting your head just nice and level on your shoulders. So stack it on your shoulders, and also think of your coach tying a string to the top of your head. So they're taking a string, tying it to the top of your head, and they're going to pull you up. So that's kind of like a nice visual cue, pulling you up to the sky, up to the ceiling, to get you nice and straight and stacked from head to toe. The next one is your shoulders. So with your shoulders, a normal tendency is to hunch forward. And when we hunch forward, we close up our chest. We actually start to compromise our breathing. So open up that chest, bring those shoulder blades back, and imagine myself or a coach is putting a tennis ball between those shoulder blades. That seems a little exaggerated, but if you kind of pull that chest open, those shoulders back, grab that tennis ball with your shoulder blades, you can feel your chest opening, and that helps with the breathing. We get a lot of questions about breathing, and everybody's different, but a good rule of thumb is breathing in and out every 2 to 3 strides. So, as you're running, as you're cruising along, every about 2 to 3 strides, you're breathing in and out, opening up that chest, bringing those shoulder blades back. And then the next thing is your arms. Those arms are going to drive the legs below you. So how we position those arms really does matter. They're not just kind of like the noodle arms. We want them working. And if you have them at a 90 degree and you're moving the arms forward and backward, so just forward and backward, that's going to give you the most momentum. That's going to give you the most relaxation from top to bottom. A tendency that a lot of people do is they cross that midline. So running like this, crossing that midline, that's actually twisting the hips, it's twisting the backs, it's twisting the chest. It's going to cause more injury. So having them run forward and backward at a 90 degree, nice and smooth. And that one is, you'll find which of these head to heels is going to be your thing. Mine is arms. I'm constantly saying arms down, arms smooth, forward and backward. And then our hands, without even thinking about it, most of the time we run kind of, tight fist. And that sends all sorts of tension all the way up your arm, all the way up your shoulder, and then down your back. I see some heads nodding. So definitely the hands. And a cue for that is just to think about carrying a chip or a butterfly, something light, something delicate, an egg, whatever it may be, but something light in your hands. If you carry a phone, try not to carry it in your hand. I have like a little strap on the back of mine that I just kind of slip on my finger like this instead of gripping my phone. So keeping your hands nice and light, nice and relaxed, those arms forward and backward. That's, the ideal from all the way from head, shoulders, arms. And then let's see here, moving down to the hips. Squaring the hips is ideal. And one tendency that a lot of runners do is we lean forward. We try to lead with our chest. And that actually puts a lot of pressure on our lower back. And also, again, just pulls on those hamstrings, pulls on those quads. So squaring up those hips and think of leading with the hips. That's kind of your mental cue. I'm leading with my hips instead of my head, instead of my chest. Lead forward with the hips. Then moving down to your legs, obviously your legs and your feet, we all have our natural pronation, supination, all that, or neutral. So the way your feet land is, again, just like India said, it's a good thing to have shoes that fit your feet properly. But ideally, you want your knees kind of over those feet. So you're landing with those knees and those feet in somewhat of an alignment as you're cruising forward. But in general, the biggest thing that I would say fixes the overall form is imagining the string on the top of your head, because as we get fatigued, we start to kind of crumble down into that seated position. So pulling up on that string as you're feeling fatigued, as you're feeling that breathing start to get a little bit labored, open up that chest and keep those arms moving forward and backward is going to drive those legs below you. Any questions on form before we move to post run?
Dana, can you
Yes.
show the band that you have on the back of your phone? Because I tend to grip my phone and I've never
Yes.
seen that.
It says Love. I don't know if that's if
Okay.
that is the brand, but can you see that? I'm sorry.
Yeah, yeah.
Okay. But
Okay.
there's several that you just kind of really tighten that grip, and then all of a sudden your
That's
shoulder
what I
starts
do.
hurting where you got a nice tight grip.
Yeah.
So this I just kind of slip on my finger and that's easier.
Okay.
Any other questions?
Yes, I think I naturally carry my run in my shoulders. So I guess releasing the hands is gonna help with that.
Yeah.
Well, and the other thing you may do is you may be pulling those
Yeah.
shoulders up.
That
So
right there.
get them away from the ears, pull them down, pull them back. And that's that, as long as you start to, and here's another thing, you're not going to fix everything on the next run, focus on one thing for a week. That this week I'm going to work on my shoulders. Next week I'm going to work on my arms. It's a process, but typically we start to say, oh, for me, it's my arms. I'm constantly reminding myself about the arms. Gina,
I
did
was
you have
just
something
gonna-
else to add?
I was going to add to that. Yeah, just strengthening what we call our posterior chain. So it's the muscles on the back of our upper body there are the ones I'm talking about, can help. So strengthening the muscles around your shoulders, Katina, can help with that too. So if you'd like, I can share some exercises. I'll send them to you or anybody else who's interested about, just shoulder squeezes and rows and things that we can do to strengthen those muscles. I know that, that can be a spot where we feel tension. And I'll give you an example. I've been running for a long, long time, but after I had my twins, I have 4 kids, but after I had the last babies, I didn't run for a while. It was rough. So I got out there to run again, and my shoulders and my mid back, just like that was a problem for me. My cardiovascular fitness was there, but so it's the strengthening of those posterior chain muscles to hold our body up and stable that can be really helpful. So I'll send you that stuff too. That's a great question. So thank you for asking that. All right, next up, Dana.
All right, so post-run stretching, India had talked about pre-run stretching, and that's where you think of movement. You want to move the body before you move your body. So you're doing those dynamic movement stretches. Post-run, you want to come back, you want to give that body a nice, easy stretch post-run. And so a lot of these they're static stretches, so they're a hold. It's either a standing, a sitting, or up against a wall, but it doesn't have to be very long, maybe 20 to 40 seconds per hold. So this first one here is just a nice, sitting down, bend one leg in, lean forward as far as you can. You don't have to touch your toes. I think I only did that for the picture. I cannot normally touch my toes. I have runner's flexibility. And you're just holding it, and you can feel it in your hips, your glutes, your groin. It just feels good. With these kind of stretches, I will make sure, to caution, it shouldn't hurt. It should feel a little bit of a release. It shouldn't be a painful thing. It should just be a nice, easy cool down stretch. and then you're alternating back and forth. The other one there is more of like a lunge. And with that, you can modify it however you need. You can do a deep lunge, you can do a reverse lunge, you can, I just like to hold it right there. And again, that feels good in the calves, the lower back, the glutes. But the static stretches, I'll send a video after this. There's like 4 or 5 that are nice and easy. You don't need to do a ton, but just 4 or 5 nice, easy static stretches post-run is really going to increase your mobility, your flexibility, and help with that repair of the muscles post-workout. Was there a question? Okay.
Is there a question?
Let's see here. Oh, a handout. Yes, we can certainly. Takesha, are you referring to a handout of all the things we need to be aware of when running? Are you referring to form?
Yes, like the head and the shoulders and the hands and the hips and everything.
Yes, I can. Yep, I can share that as well. Just those little cues. That way you can, slowly work on it. But yes, certainly. And then post run foam rolling. This is another great post-run activity. And this is one that you can do right after you work out, right after those static stretches, or it's something you can do later in the day. I personally like to do mine in the evening, spend 5 to 10 minutes at night, just kind of rolling out those muscles. Gina, I'm gonna let you talk more about the foam rolling, just as far as the lower back and just some of those precautions.
Sure. Yeah. So we actually did a foam rolling class, Dana and I, last cohort, and we generated some of these pictures that I'm sharing with you right now, just to kind of give a little more feedback. I thought it would be helpful to throw it in here. That way you have the tools you need if you want to start working on these things, as you progress through your 8-week program. But yeah, so, Dana, I'll just speak, since I'm speaking, I'll just speak to how to go about foam rolling too. You can, you're rolling along the muscle that you're trying to relieve tension. And so here she's rolling the hamstrings. You can hold the foam roll on the more sore spots for a little bit longer, but just being careful. This positioning isn't bad. I don't mind it, but just being careful. Like if you think about someone, if you have pain in your wrist, would this be a good way for you to roll your hamstrings? Probably not. So just making sure that when you do it, that you're positioning. For the back, it's okay. That the back is the piece that I'm always thinking about. But yeah, just making sure that your positioning is okay. Here are some of the other common postures that the other common muscle groups and positioning that we use for foam rolling. You can use different tools as well. You see some different devices pictured here for just different muscle groups. But again, just being aware of your positioning. Now, almost every picture here is a pretty good picture, except for the one on the bottom where the woman is on a green mat. She's rolling her glutes there, which is great, but her back is a little bit bent and twisted. So those are the things that I want you all to think about. She's rolling her IT band in the top picture, where she's on her side there, and that could tweak the back too. So just thinking through those things when you're foam rolling, and remembering that this is to relax those muscles. This is not necessarily to treat pain symptoms. So if you have pain, we want you to reach out to your physical therapist, or me, even if I'm not your therapist, because I want to help you through the pain. Remembering that this isn't necessarily a fix. And while I'm on that, again, on back pain, if you do have low back pain, and for most of us can benefit from this who sit in postures all day long, and when we run, this exercise here allows us to unweight our low back. It's simple. You lay on your back, you bring your knees up to your chest. I love to do this one. You can squeeze your knees tightly. Notice that the hand placement is behind the knees. And I like to lay there for 2 or 3 minutes. Sometimes I'll do some breathing. Maybe you can practice your mindfulness. You can say a prayer, whatever it is. And Takesha, feel free to unmute and ask your question.
So what kind of foam roller should you get? Because my coach said a foam roller this week, but I don't really have one already. So it's like 3 different pictures here.
Yeah, there's a lot of options, and I think the answer is really whatever works best for you. In terms of which one you get. When we did the talk, Dana showed all the different fun ones that she has. But I think the answer is whatever works best for you. Some of them have ridges, some don't. You kind of have to try them. Dana and India, do you all have anything to add to that?
I agree. I think it's one of those where you don't want it to hurt. It shouldn't hurt. It's kind of what I would like to call a happy hurt. You can feel it on your muscles, but it shouldn't be a painful hurt. If you go to the running store, the one that you get, running shoes, running specialty stores, they have all of these tools there. So that's a great way to test out all the foam roller options. There's balls. There's one that I like that's called the stick, the marshmallow stick, and it's one that you actually hold, and you can do a lot of the foam rolling seated in a chair. So that reduces any of that pressure of holding up your body weight. But it just depends on the area, and it also depends on how much pressure you're putting on that particular part of your body. So I would check out a few of them. You can send me an email if you're looking for more specifics, but there's so many options. But starting with just the basic foam roller is a great way to start.
Yeah, I would say I have a couple of them here in my hand. So this is kind of one that I started out when I first started doing foam rolling. It's smooth. It doesn't have like a lot of ridges. And then sometimes when I'm really trying to get in there, I use this trigger point one that has a lot of ridges and usually goes a little bit more, to me, a little deeper in the muscles. And then this is one of the sticks that Dana was mentioning, that you can actually sit in a chair and actually roll it around. So this is, I love trigger point for foam rollers, but you can get foam rollers from like Marshalls. Like, you don't have to go expensive on foam rollers. You can get them from Marshalls, things of that nature. They don't have to be expensive items, but there's so many different forms. I think I have 2 more other types of foam rollers that can be used, but you have to figure out kind of what you need and work best for you. And so again, so it doesn't hurt.
Yeah, that's awesome feedback. And I think you're right. I think that's important to say, like TJ Maxx or whatever you have near you, they have some really good options. And I love the stick as a physical therapist because you can keep your body supported and get those areas and not have to bend and hurt your other joints. Awesome. Okay, so I want to respect everyone's time. We're bumping up on the end of the presentation, but I just wanted to really, really reinforce the importance of taking care of your body, not waiting. If you're having pain, please reach out. And you know what? I care deeply for all of you. And even when you've completed your 8-week program, I'm here. Shoot me a message, shoot me a text. I want to help you with your pain symptoms. And sometimes it might be, hey, you need to follow up with a doctor, or we need to get some imaging or whatever. But you take care of your body. And feel free to contact us directly with questions from this presentation. I also just want to take a moment to thank India and Dana for presenting with me again. This is our second go round on this one, and I appreciate it so very much, and I appreciate all the amazing work that you both do with your participants. You're phenomenal women, and I am very grateful for you. So, and to each of you out there, keep going. You're going to be so amazed at where you are at the end of this 8-week program, and we already are just rooting for you and so proud of all of your hard work. So I'm going to wrap up with that, unless India and Dana, you have anything else to say.
I just had one other thing to say when Dana was talking about form, and that's just when we're talking about form and kind of foam rolling, all of this is another reason why strength training is so important in this process. I know as runners, we like to run, but we need to strengthen those muscles as well so that it can carry us that way. So congratulations to everyone. And I'm glad that I was able to give you all some information today, but don't forget, it's a holistic approach. Stretching, all of that good stuff is all for the running.
Yes, I agree with all that. Thank you so much for joining. Keep up the good work and reach out. We're here to help you. So keep it up. Great job, everyone.
Awesome. Good night, everyone. Thank you.
Good night. Thank you.
Bye. Bye.